I'm Garvin Lynch, and this is Lynch's Pharmacy Health video series. This video is on eczema. So eczema is also called dermatitis, and is a general term used to describe an itchy inflammation of the skin. There are different types, but most of them involve red, cracked, scaly skin. It could be very dry or could be weeping and a little bit wet. The different types of eczema are atopic, seborrheic, and contact and allergic eczema. We'll start with atopic eczema. It's probably the most common type, especially in young babies and children. It appears as red, swollen skin, often with little papules, little raised parts of the skin, and very often on the face, especially across the cheeks, and also on any parts of the body that has flexures, so inside the elbows and behind the knees. This is unlike psoriasis, which is on the outside of the elbows and on the front of the knees, on the kneecaps. If there is any history of asthma, hay fever or eczema in a child or parents, all three of these conditions are what's known as atopic conditions, and they're all related. So if you or your parents have had one of these three, you're quite likely to have one of the others as well. In terms of treating it then, treating eczema should be viewed as a long-term management more than just treating it every now and again when it flares up. If there's a flare-up in a known eczema patient, it can be treated quite well using a steroid cream like 1% hydrocortisone. This is only a short-term treatment, by no means to be used on a long-term basis. Generally up to 4 weeks continued use before you'd have to go to a doctor. So as I say, only a short-term basis, never to be used on the face, just on the body and neck and behind the ears if needs be, and also to be used sparingly. To judge how much to use, we use what's called a fingertip unit. 1 fingertip unit is the amount of cream you can fit on the tip of your index finger, and this is enough to treat an area the size of the back of your hand. So that's what we use to judge exactly how much cream to use, and not for more than 4 weeks. So it's very good in an acute flare-up of eczema. In between flare-ups then, and indeed during them, emollient creams and ointments are the main part of treatment. These lock in the moisture and keep the skin hydrated, so aqueous cream and an emulsifying ointment are two of the better known ones. Emulsifying ointment is probably more effective than aqueous cream, but it's greasier and much messier. For that reason, people tend to use emulsifying ointment at home when they're staying in, and if they're leaving the house, they put on some aqueous cream because it's less greasy. Recently though, the aqueous cream has really fallen out of favour in terms of treating eczema, because it's been found it can actually have a negative effect and maybe even make it worse. So the emulsifying ointment is really been pushed now as the main treatment for eczema and dry skin conditions, and reserving the aqueous cream maybe just for a soap substitute, because eczema sufferers shouldn't be using perfume soaps or bath additives or other cosmetics like this. So substituting soaps with these products is a good idea. It's very important as well that emollients are used after taking a bath or after washing. Just by the way they work, they lock in moisture. So the logical time to use them is after taking a bath. It's very important to use enough of them as well. An eczema patient whose symptoms are bad could easily go through one of these 500-gram tubs a week. That just gives you an idea of actually how much you have to use. The most common problem with them is that patients don't use enough, so it's important to use them regularly and after taking a bath. The emulsifying ointment also works very well in the bath if you can dissolve or melt 100 gram in some hot water first and then add it to the bath. It's not a good idea to add it straight to the bath because you usually end up with clumps of ointment floating around, which doesn't do much good. So melt it first with a bit of hot water and add it to the bath. Other emollients then are the likes of oilatum, eucerin. Eucerin has urea in it, so usually used from the age of 3 and up. Elave, Silcox base, E45 and Aveeno. All of these do a full range of products such as bath additives, body washes, lotions, and most of them do a children's version as well. So the likes of Elave do Elave Junior, and there's Oilatum Junior. So there's products for the adults and there's products for the kids as well. All these emollients are very good when the skin is very dry and cracked. But as I've said, sometimes the skin may be weeping and a bit wet. If this is the case, a potassium permanganate solution is often beneficial. Just dissolve a couple of crystals in a cup of water, put the solution on the affected area for about 15 minutes, and do this 2 to 3 times a day, and this will dry up any weeping or wet skin. So if you have any questions, you can contact me through the live pharmacist on the website. You can email me or call into the pharmacy in Broaddale, Maryborough Hill in Douglas. Thank you for watching.